Good evening, everyone. I'm glad to be here, and I think we've had some wonderful conversations up to this point. I'll come in with you from information with what we have been doing in the schools this year. This is our program. It's called Signs of Suicide. If you have a 7th or a 10th grader, you may or may not have heard them speak of this. And have even some of these discussions, especially, some of the things like Maren was talked about and what Grace had mentioned earlier, and just having how important it is to have those conversations with our students. So we'll go ahead and get started, and I'll give you an overview. You can skip that one, Felicia. Yeah. But we're looking at why our Hanover County chose this program, Signs of Suicide. It is a universal-based suicide prevention program that has shown a reduction in self-reported suicide attempts and randomized controls trials. And when the research has shown us that when students were in a control group and they were compared to others who received SOS, the statistics shown that there was repeated more favorable attitudes towards getting help for themselves or friends for depression and or suicidal thoughts, and they were 64% less likely to report a suicide attempt in the next 3 months after receiving the SOS training. So the goal of SOS is ultimately to prevent youth suicide. And when we're going through this program with their students and giving you a little bit more of the factual information that the studies has shown, it increases the knowledge and adaptive attitudes about depression. It encourages individuals to seek help on behalf of themselves or for a friend. Definitely reduces stigma. We talked about that earlier with mental illness, physical illness that could ultimately require treatment. Our goal is for it to engage parents and school staff as well as partners in prevention. And it encourages our schools to develop community-based partnerships. And that's where we are today in with this presentation. So these are the components of the SOS program, and this is just to give you all, as parents and community members, what it looks like when we are in the classroom. And like I said earlier, this presentation is geared specifically towards, we have the middle school curriculum and the the high school curriculum. So we're looking specifically at 7th and 10th graders. We went into their PE classes and in each of our middle and high schools. And when we introduced the SOS program, we set those expectations, talk about confidentiality, and even as the students, if they have a friend or even themselves they're concerned about and want to share that information, we just, let them know this is, it's serious, but we still have to remain in the confines of confidentiality. Then the third thing that we're looking at with the components in the classroom, students watch a series of 3 videos with each of them having different scenarios, and there's a discussion after each one. And depending upon the middle or the high school, they are age appropriate with different types of scenarios that goes with that age group. And then after the students watch the videos, they go through the discussion, then they will complete a screening and the student responses slips. And with those screenings, what we're looking for 3 ways to identify our students in need. The first is help seeking students to act. And SOS, the Signs of Suicide program, they have an acronym for ACT, and it's called Acknowledge, Care, and Tell. So it's something easy for the students to remember. The second way that we identify our students is through the student response slip. And then the third way, it's called a BSAD screening, and BSAD stands for Brief Screen for Adolescent Depression. And this screening tool is not a diagnostic tool. We as school counselors, we are not qualified to diagnose any type of formal depression or anything, but that's just a mere screening to let us know where the students are. And then the fifth component is we collect all the forms, and that's the school counselors are presenting these lessons to our students. And after the forms are collected, we assess by a color coding system. Like, think about a red light. Red is severe, they need help. Yellow, they're okay, maybe need to just reach out and talk with a counselor. And then green, they're okay, but still maybe need, a little assistance, maybe just need to check in on the student. And then this last and final step, we follow up with any students that is requesting help from the screening. And with that, when we are handing out or collecting the slips from our students, we just generically say, we may be pulling little Johnny to come in and talk with the school counselor. And we want students to know, if we're coming into a classroom to pull little Johnny, it's not because he has suicidal thoughts. We want to talk to little Johnny just to see how his day's going, what he thought about the program, so the students, that way we're trying to keep those that are in serious need and could possibly really need, more in-depth screenings. We're trying to keep that confidentiality piece with that student that really truly is in need of maybe more intensive attention to their needs, and talking with them about, their any kinds of signs of suicide that they may be experiencing at that time. And this is a quote, and just to reemphasize the how important and how we believe, as far as Hanover School Counseling, and how much we believe in this program. And looking at this this quote here from David Miller, it says, screening for possible suicidal behavior in students' presence, a variety of logistic challenges. But the fact remains that student screening likely represents the most direct and efficient way to identify potentially suicidal youth. And it is a critically important element of any public health approach, school-based suicide prevention. So there again, that just, helps to reemphasize the importance of looking at a program that is, has the element of, having that fidelity in the programming. And so here, this is just, this is all 4 high schools and all 4 of our middle schools. So you can look at the numbers there. We had 209 students that were identified as a concern. And then we had 18 out of the 209 where full assessments were completed. Parents were notified of their concerns and talked with school counselors. And that was carried through with fidelity with parents and students and our school counselors. And then you can see the middle school students there. We had 242 concerns, and then 35 assessments that were completed there. And so parent and community engagement, and we've talked a lot about this, but this is just these are numbers specifically related to our SOS program. So 50 to 90% of parents were unaware of their child's suicidal thoughts. They're again bringing in that important piece of having that communication with your child. 60 to 95% of parents unaware of suicidal attempts reported by their child. And then thoughts of suicide are often hidden because youth are confused, embarrassed, or ashamed, and that could be, for a multitude of various reasons. And then schools and parents must work together to watch for warning signs and reach out for help if needed. And I think that Maren mentioned a lot of these points earlier in her presentation, and there again, just communication between school, home, and checking in on that student, and even counselors. If a child's seeing a counselor outside of school, if there's a release form that needs to be signed so the school and that outside resource can exchange information, it's important. But because most of the time the counselor is the one that would get these kinds of referrals to be able to help to work with the child in need, something we're kind of about while they were at school. So reducing the risk there again, it seems that, they're opening up, having a conversation about mental health. And of course, we talked earlier about, I think with Laura's presentation, talked about having the guns being one of the most fatal pieces of information, or excuse me, not information, but ways of suicide. Not having those in your home, or storing them in a locked cabinet, keeping them away from your children. That's just a couple ways there, that was suggested just to reduce that risk. And here we have watch, listen, and respond. There again, we've talked about a lot of these already with a couple of the other presenters, but just watch for significant changes in the behavior, withdrawal, anger, hostility, increased agitation, irritability. Listen, talk with your child, listening, talk about if they're talking about suicide, sounding hopeless, being overwhelmed, and respond immediately. If your child is showing warning signs, just simply being able to respond and be in there with and help your child. And this is the links to the MindWise innovation that created the Signs of Suicide program that we are working with and that we have been using. And these are actual infographics that you can access through their website, and looking at other tips and tricks with talking with your child, ACT, and there's national resources, and then the website there. If you're feeling concerned about your child, you can take a mental health screening through their website, and that will maybe be a good indicator, maybe be just one of those little tools that might help you to better gauge where your child is and their feelings and their emotions. And another infographic, just a little bit more in detail, and then the welcome signs of suicide for parents. That is the link directly for parents, and it gives you a list of ideas, signs to spot. You can take the screening, you can watch videos, talking with a child, and then other parent materials. And the National Suicide Prevention, I know that we've had local resources that were listed, but also, this is just another tool for you to have, and also the crisis hotline. That's something that you can reach out, and of course, always 911 if you ever needed that. But that's my information. I work at Patrick Henry High School and Hanover High School, and then I have my email and my phone number there. But thank you all so much, and have a great evening.